You are using the computer audio. Connect again.
Amit sir, are you able to share your file?
Hello.
Yes, sir. Sir, are you able to share your slide or
Just a minute. No.
you are not? Okay, just give me a minute. Sir.
Background is visible.
Yes, sir.
Column. Column. Hello. Hello.
Yes, sir. Should we start, sir?
Screen is disabled.
So just give me a minute.
Hello.
Yes, sir, we are trying. Just give me
Okay.
2 minutes.
रूपाली मैडम देखिए
So please check. Are you able to?
Yeah.
Okay. So welcome back again for the second session of day 1 from Atal sponsored 5 days FDP program. Application of biotechnological and analytical tools in pharmaceutical research. In our session 1, we have discussed about the analysis of drug and pharmaceuticals using HPLC. Now, in this session, there will be online hands-on training on HPLC by Mr. Amit Kumar, Technical Officer, Instrumentation Division, CSIR, Indian Institute of Integrative Medicine, Jammu. So I request you, sir, to take over, please.
Okay, welcome back. Good afternoon. My background is clear.
Yes, sir.
Okay. HPLC दिख रही है, I think. Okay.
So your screen is not visible. The
It is
screen which you
visi-
have shared.
It is visible now?
No, sir.
No?
No.
Your screen sharing is paused. Is it visible now?
No, sir. Yes, sir. Now it's visible.
Visible? Okay. Okay. Good afternoon and welcome back again. Now I'm going to discuss about practical knowledge about the HPLC. How the HPLC work, how we perform HPLC, how we use HPLC. And first of all, we should discuss about the hardware part of the HPLC. Okay, like already I have discussed about the different component of the HPLC, starting with the pump, solvent reservoir, injector, column oven, detector, and the software. Okay. So first of all, which is important part in HPLC is pump, from where it is started. So solvent delivery system, which is generally operated by the pump, it basically it should have some the things like it should withstand high load pressure. It can pressurize the system. Pulsation that accompany pressure fluctuation are small. Means fluctuation of pressure should be small. Flow rate does not fluctuate. And solvent replacement is easy. Means we have to change the different solvents, though it should be easy. It should not require much time to flush the system. Then we use second one. So solvent replacement should be easy. Second thing, and next thing is like flow rate setting range is wide. Like you can choose a pump where you can use a flow rate of 0.1 ml per minute to 10 ml per minute, like this. So according to this, there's a lots of pumps are available. Different pumps are available. Like syringe pump is there, plunger pump is there, diaphragm pump is there. So like this is a plunger pump which is commonly used nowadays. So this is a general diagram of the plunger pump. In this, there is a motor is available. Then this is a plunger, and there is some seals are there. Then there is some check valves are there. So by movement of this plunger, there is a pressure is obtaining, and this help in flow of the mobile phase. So these are the check valve and plunger head which is there in the plunger pump, and this will help in checking the flow rate as well as how much pressure is obtaining. So there is a machines are there which are having a dual plunger type, which can help in like binary pumps are available in market, which help in the better gradient technique. So in this, two plunger pumps are attaching with the pump. So two plunger units are attaching with the pump, and that will help in the pressurizing the solvent. So by this we can have a two type of system: HPLC system, isocratic system, gradient system. In gradient, it can be have a two type of gradient: high pressure gradient and low pressure gradient system. Like this is isocratic, as already discussed. Like fixed concentration of mobile phase is generally running through the HPLC, and it helps in the separation of molecule. It is already we discussed about this, and it have some limitations. So as well as positive points, so we can use isocratic mode or gradient mode. So this is about the gradient technique, in which we increase solvent with the time, concentration of mobile phase with the time, and we increase the polarity, and we got the separation. So due to this plunger pump, different type of plunger pumps are available, and due to that we can have a HPG, high pressure gradient, and low pressure gradient HPLC. Like generally HP high pressure HPLC system generally have two pumps that generally called as a binary pumps, and the two pumps are available, and that will help in pumping the solvent, and it is having some mixer and which help in mixing the two solvent and provide the concentration of solvent which you want. And nowadays there is a low pressure gradient machines are also available, in which you can use quaternary system, in which one plunger type pump is there, and that is having mixer, and that help in the pumping the solvent from the different reservoir, 4 different reservoir, and it finally mix at the point of mixer, and it can be used. But the drawback of LPG is like it required degasser, and accurate gradient sometimes not happen. But in high pressure gradient technique, it is a drawback is like complex system, but you get the high gradient accuracy. So that is a best part of high pressure gradient system, right? So then after the pump, there is a requirement of degasser. As already discussed, the LPG system which we generally used, in that degasser is there. Degasser help in the degassing the mobile phase. Otherwise, sometime what happen, there is a bubbles are there in the solvent, and it will unstable the pump flow. So due to that, there is a noise and large baseline drift can be occurred. To avoid this thing, we generally have degassed system, and for this degasser is required. So generally this type of system you will find on the degassing unit. There is a regulator, there is a valve is there, solvent, there is a some helium, like earlier there is a helium cylinder is there for the degassing the thing, but nowadays there is a vacuum chamber is available and polymeric film tubes are available, and that help in the degassing of solvent. So degasser is required to remove the gas which help in proper continuous flow rate of the flow of the mobile phase. Next is next part of the machine is injector. So it is very important, like you have to inject the sample. So there can be two type of injections are there. Injectors are there, manual injector and automatic injector. So if you are having a proper automatic injector, so you will get some benefit of that, like no sample remaining in the unit, minimum broadening of the sample band, free adjustment of injection volume, minimum loss, and superior durability and pressure resistance. So generally this is the inject position and this is the load position. Like this is injector where you get sample is loaded, and this is rotor present in the HPLCs where this point from where sample is injected. So manual injector is also there. So in this loop is available and we inject through the syringe. So generally this auto sampler, it is a pressure injection method basically, and this pressurized system will help in injection to the port and it will goes to the loop, and where it is mixed with the solvent and goes to the column and further detected by the detector. So these are the schematic diagram of the auto sampler with the load position and inject position. So in this is a closed one, and this inject position, this is a open one. So where injection is take place and goes further for the analysis. So then there is another type of auto sampler in which total volume injection method is there. In this this is sample vial. From there in this load position it is loaded and it's further closed down to inject position. Then another important part of the HPLC is column oven, where generally column is placed and it is heated to maintain the temperature, and that temperature helps in the separation of the molecules. So generally there can be a air supply heating type, block heating type, insulated column jacket type. So there is a different type of column oven compartments are available with the different techniques. So which is helping maintaining the temperature inside the column compartment. So other than this, there is a tubings which are used inside the HPLC for the movement of the mobile phase. Like as there is a stainless steel metal tubings are there, PEEK, polyether, ether, ketone tubings are there, fluororesin tubings are available, which are used for the HPLC connections. So they have different diameter, like OD outer diameter is 1.6 meter, inner diameter 0.1, 0.5, 0.8 like this. So different type of diameter tubings are there for the connection of HPLC. So and there is some ferrules and nuts are there, which is connected through the different tubings and valves. So these are the ferrules and these nuts are there, which is attached and connected to the different tubings. So due to this ferrule and all can also lead to some troubleshooting problems. Like dead volume can be caused if there is a dead volume, then it can cause a peak broadening. So if you are having a poor connection with the ferrule inside the column or inside the tubing or check walls, so you will have a dead volume, and which create a problem in the your baseline as well as your separation. So you should have a proper connection of the ferrules. So these are the some parts which is there, and for this we require some mobile phase, like we already discussed about this. So whenever you are using a solvent, so there should be a few do's and don'ts are there. So like, first of all, mixing, filtration and degassing is required. Whenever you are using a solvent, any solvent, first of all, it should be HPLC grade. You should use HPLC grade solvents only. Then you should mix first and do filtration. Filtration generally do with the 0.45 micrometer syringe filters. Then it should be degassed using a ultrasonic bath, ultrasonicator or ultrasonic bath. So by this, you generally mix or degas the solvent. So next part, which is very important, that is detection. How these, after like solvent is pumped through the pump, then it is goes to the injector where sample is injected, then it is goes to the column, then column to detector. Now detector is very important. So what are the conditions? What are the minimum requirement detector is required, and what are the different detectors are there which is used for the HPLC? So first of all, the detector should have the appropriate level of sensitivity. The sensitivity is very important always. Second is selectivity. It should have some selectivity towards the targeted substances. So selectivity, sensitivity is very important for the detector. Next, it should have adaptability with a different type of molecules. Like it should not be like that it goes with the one kind of molecule only. So adaptability to the separation condition should be there and should be adaptable with the different type of mobile phase and easy to operable, easy to operate. So operability should be there. So what are the different HPLC detectors available in the market? Like UV visible absorbance detector, photodiode array detector, fluorescence detector, refractive index detector, ELSD detector, electric conductivity detector, electrochemical detector, and mass spectrometer. So as we know, UV visible detector or PDA detector, which is based on Lambert's Beard law, and it is always depend how much length is passed and concentration of sample. So on the basis of that, absorbance take place. So it is detected the absorbance of light by the molecule. So this is a general principle of the UV visible or PDA detector. So generally you will get this UV spectrogram from the this UV visible spectrometer, and you will show it according to these lambda maxes in a peak form. So you will get the peaks according to their absorption of the particular wavelength. So generally this is a optical system of the photodiode array detector. You will have a deuterium or tungsten lamp. There is a sample cell is there. There is a grating is there. Then where it is light is collide and then it is absorbed, and you will get the peaks. It is detected by photodiode array detector, and it will shown in according to the peaks as per the absorbance. So this is a general data you will obtain from a PDA detector. So by this PDA, you help in identification of molecule according to their retention time. You can also match with the library searches. and you can find which is the compound it is, and help in detection of peak purity. So these are the some benefit of photo and it is very like you can use in different conditions. It is very like can be used in different type of compounds and can be used for the different type of mobile phases. So another detector is fluorescence detector. It is depend on the fluorescence, how the compound is emitting and absorbing the light. On the basis of it, that detector is detecting. So this is a fluorescence detector. So this is a general diagram of the fluorescence detector. The xenon lamp is used where it is passed to the sample cell, and where it is compound is excited and it will be detected by the fluorescence. So sometimes we require some OPA reagents to convert molecule into the for fluorescence detector for the detection of that. So we require some OPA reagents or ADM reagents to convert into fluorescent active molecules. This is a flow diagram of refractive index detector where refraction of the light is detected, and it is like a sugar molecule generally detected by this because that is having some chiral centers and that is reflected the light, and so this is the one of the detector which is used. This is a diagram of evaporative light scattering detector where light is scattered through the particles and which is detected by the detector. This is about the electrical conductivity detector. It detects the change in the conductivity. And the most important detector nowadays which is used, that is a LCMS or mass spectrometer. Mass spectrometer can be a different type, like we are having a single quarter pole detectors are there, triple quarter pole detectors are there, MARDI is there, time of flight, time TOF is there. So lots of detected techniques are there, like a quarter pole technique is there, where HPLC is connected with a triple quarter pole mass spectrometer, and as the sample separated through the column goes to the mass, it is ionized and fragmented into different ions, and that ion is detected by the different quarter poles of the mass spectrometer. And in this you can get the accurate result, like it is detected the different fragments of the molecule. So every molecule have their unique fragments, and further you can do the MSMS of that molecule, like you are going to fragment, you are from the first peak you are getting a daughter ion, from the daughter ion you can further fragment it, so that will help in accuracy. So that is one of the important detectors which is used nowadays. So generally most common triple quarter pole technique is based on these two mechanism, ESI mode and APCI mode. So ESI mode is generally, or in this there is a electrode spray ionization in which there is a mist is generated and where charge is applied, and on this basis of the charge it is further uh, like fragmented and the daughter ion is generated. So like this there is a generation of daughter ions, and that will help in detection, and further you will say this is the molecular weight. APCI mode, it is like it is also the same kind of thing. In this there is a chemical ionization take place, it is through the uh, there is a corona discharge needle is there, and that will help in dissociation of the molecule. So that is a basically APCI mode is for the non-polar molecules and ESI generally for the polar molecules. So like this, it is showing different M by Z, like there is a 100 molecular weight and this is a 150 molecular weight. So it is showing after the ionization. So in this peak can be identified in mass spectra, and that is very accurate one because you will get the data according to their daughter ions. So this is much accurate. But like in PDA, you will get the data according to retention time. But sometimes two molecules can have a same retention time. But maximum, like most of the cases, the mass, the compound should have, they have unique mass spectra. They generally not matching with the other one. So you will get the accurate data with the mass spectrometer. So these are the different uh, comparison of different detectors like UVPDA, generally light absorbing substances. It is for the light absorbing substances, and sensitivity is for till nanograms. Gradient system can be run on this. Fluorescence for the fluorescent substances. Peak detection can be done in picograms. Gradient system can be done. RI in this refraction is required. It can be detected in microgram. Gradient is not possible in this case. Evaporating light scattering ELSD, it is for the non-volatile substances. Microgram, it can be detected in the micrograms, and gradient system can be possible. Electric conductivity for the ionic substances, it can detect in the nanograms. Partially soluble, possible in gradient system. Electrochemical, it is for the oxidizing and reducing substances, and sensitivity is very good in picogram, partially possible for the gradient system. So by this, you can have a quantitative analysis. Like through this, we can perform, like already I've discussed, like qualitative, quantitative, and preparative work. Like through this, we can do a qualitative analysis, and in this we can, like if we are using a PDA detector, so identification is based on generally retention time. So based on the retention time, we can identify the molecule, and through different detectors we can identify the molecules. And like already discussed, through this preparative work can be done, and different molecules can be separated. Quantitative, in this generally quantitation is done by according to the peak area and height, and according to this percentage area is calculated, and by this you will calculate, you make a calibration curve through the linearity graph, and you can detect sample according to the calibration graph. So generally for the quantitative analysis you require a marker, and you perform a linear calibration through the, like linear calibration can be done through the two different techniques. Like first one is serial dilution, and through volume of injection. Serial dilution is like you are preparing a different concentration, 1 ppm, 5 ppm, 10 ppm, 15 ppm, like this. Or second way is like a through volume of injection. If you are having an auto sampler, you can inject a different injection volume, like 1 microliter, 2 microliter, 5 microliter, 10 microliter. So through that you can make a calibration curve, and then you run a sample. If sample percentage areas fall in between the calibration level, then it will detect how much concentration is there. So that is a very absolute technique, and to further authenticate this, internal standard can be used, and that internal standard can validate your method that it is correct or not. Okay, like this, you are having a different four concentration, C1, C2, C3, C4, and it after running it will show different area, peak areas, and this will showing the linear calibration curve. And if your sample is falling in between these concentration, then it will show how much concentration of sample have particular compound. So this is the technique for the quantitative analysis. Similarly, you can also perform with the international standard, and international standard should have similar accurate, like you are adding in a particular concentration, it should give similar concentration or area after every injection. So this will help in validation of your method. So always this international technique help with validation of your method, and it gives same area ratio all every time. Okay. So what are the criteria for international standard selection? It must have similar chemical properties to the target substance. Almost similar होना चाहिए. Its peak must appear relatively near that of the target substance. It must not already be contained in the actual sample. Sample should not have that international standard. So that is one of the important requirements. Its peak must be completely separated from those of other sample components. Separation of two peaks should be there, like from your desired compound and your intention, they should be separated. It should be chemically stable. That is a minimum requirement for the intention selection. So by this you can have a quantitative analysis, and after making a graph according to this calculation, you can calculate the concentration of sample. So there is a some for the running of the system, there is some requirements are always there for minimizing the troubleshooting of the HPLC. So first of all, sample pre-treatment. So sample objective of pre-treatment is always required because it improves the accuracy of quantitative values, to improve the sensitivity and selectivity, to protect and prevent the deterioration of column and analytical instruments, to simplify measurement, operation and procedures, and to stabilize target substance. Means it will help in column performance. You will get the better result. You will simplify the operational and operational procedures. You will get the robustness. You will get reproducibility. So pre-treatment is always required. So what are the pre-treatment conditions are required? So there is a few substances that must not be injected into the column. First, insoluble substances. If you are having some insoluble particle in your sample or in mobile phase, it can enter into the column. Maybe it can choke the column. So you should not use insoluble substances. So whenever you are going to use a sample, prepare in a solvent which is having the maximum solubility. Then filter it. That is a minimum requirement. So insoluble particles should not be there. Substance that are precipitated in the element. Any substance which shows precipitation in the mobile phase, it should not be used. Otherwise, it will choke your system, it will choke your column. So precipitated substance should not be used. Substances that irreversibly absorb in the packing material, like which cannot be removed from the column, that should not be used. Otherwise, your column will be damaged, and these columns are very expensive. So you should not use these type of substances. Substances that dissolve or chemically react with the packing material, that also lead to damaging of column. So you should not use. So before anything, you should do filtration, centrifugal sedimentation. So that is very much important always. So in general, filter every simple sample before injection. It is convenient to use syringe filter with the size of 0.45 micrometer, and centrifugal separation can be done through the centrifuge, right? So these are the thing which is must before the introduction of your sample to the HPLC. You should do deproteinization. So sometimes precipitation lead to column damage. So you can add some precipitating agent before you are using the sample to the HPLC. So addition of organic solvent like acetonitrile. Acetonitrile can precipitate the proteins. So you can use some organic solvents that help in precipitation before HPLC, right? Addition of some acid, trichloroacetic acid, perchloric acid can help in precipitation. Addition of heavy metal and neutral salts. Another thing is ultrafiltration. You can do ultrafiltration for the deproteinization of the sample. Okay. So this is a solid phase. You can also do solid phase extraction before entering running the sample to the HPLC. That can be done to minimize the troubleshooting. You can do pre-column derivation, which help in detection of the sample. So OPA reagent can be used. 2,4-DNPH reagent can be used for the derivatizing the sample. Otherwise, you will not get a peak in the detector. So after this, your method is like you have set the different conditions of method, like you set the flow rate, you set the column temperature, you set the gradient system, you set the column, and you prepare the sample. And after that, you run your analysis and you will get the data. After getting the data, how you are going to validate, what are the conditions for validation. Whenever you are in industry, you require a validated method. So different techniques are there to check the validation. So accuracy, one of that technique is accuracy, precision, specificity, detection limit, quantitation limit, linearity, range, and robustness. So these are the different parameters of validation. So that will help in evaluating your method, your system for the accurate result. So accuracy, like how much accurate your system. After running your sample, you will different sample injection, you will get the same RT. You can take a like a 95 or 105% plus minus you can take, but how much you are getting an accurate result. Okay. This accuracy also can be done by the recovery test. There is a recovery analysis is also there. You adding your known concentration to the sample and you are detecting that. That also help in your recovery study as well as your accuracy of your result. Precision. Precision is degree of coincidence of series of measurement obtained by repeatedly analyzing multiple samples taken from a homogeneous test substances. So how much similar result is you are getting? So that is a precision. So you should have precise data. So you should not have higher standard deviation. So that can help your validation of your method. So in this you can take data interday, intraday, like reproducibility. So you will get the precision parameter accurate data from these your running conditions. Next is specificity, like how accurate is specified to analyze particular substance. So that will help in detection of specificity. So like you have to, how you are going to evaluate this confirmation that target zone can be discriminated, separate from the coaxial component related to substance decomposition product. Like you are getting a data in which you are detecting the peak, which is very correlating with the other similar molecule. So that will give the specificity information from the method. So that is another point. Detection limit, how much lower detection can be detected by the HPLC. That is a detection limit you can perform by this. So for this, you should have a signal to noise ratio and standard deviation, and by this you can detect how much lower concentration you can put and which can be detected by the HPLC. Quantitation limit, it is similar as a this detection limit. It is a limit where minimum quantity of target substance that can be quantified, at which quantification can be done at which concentration. That is a quantitation limit. So that is another validation point. Linearity, the ability of analytical method to produce measurement of for the quantity of target that satisfy a linear relationship, means you are increasing the concentration of sample and you are getting a proportional area of the sample. So that will give the linearity validation. So this is another step to check the validation. Then there is a range, how much range of the concentration can be detected by the HPLC. Robustness at different conditions, the method is accurate, like ability of an analytical process to remain unaffected by small change in analytical conditions. So that is a robustness. Machine should be robust, otherwise you will get the problems in future. So robustness should be checked. Now the maintenance of separation column, how you are going to maintain a column. Like already question asked by me, question is asked about the how we maintain the column. Like already we know there is a different resin based or silica based columns are there. Generally pH range of the silica based columns are 2 to 7.5. So we should not deviate from this. If we are using a higher pH range or lower pH range media like mobile phase, then it will damage the column. Resin based, generally a wide range of pH is there. Organic solvent, generally in silica based no restriction, pressure resistant 25 MPa. If you go beyond this, it will deteriorate the column. In resin based, it is a low pressure resistance. In temperature condition, 60 degrees max for the silica based, and resin based, it depends on the packing material. So we should not go beyond 60 degree in silica based columns. So how we handle the columns? So first of all, we should maintain pH conditions. Should not be dry. We should not make it dry. Like you are not using the column from the past 1 year, and you are not you are making it into a dry condition, and that will further going to damage the column. So you should store column in a ACN. You should run a column with the ACN, then you can store. You should not allow particles into the column. It will damage it. Always use a low pressure in column. Higher pressure generally can damage the column. So we should not exceed the upper pressure limit. So what are the preventive measures to prevent column clogging? Filter the sample, check that sample dissolve in the eluent, get in the habit of observing pressure values. So pressure should be maintained. How we correct that? Check for clogging parts other than the column. First of all, check clogging in different parts of the HPLC. Rinse with the appropriate solvent. If you got column is clogged, then you should rinse the appropriate solvent. Connect the column reverse side, column को reverse कीजिए and flush with the solvent. That will help in regeneration of column. Open the column end and perform ultrasonic cleaning of the filters. Your column is attaching with the filter, you should clean that to further damaging the column, because maybe that filters have some particles that can go into the column. So we should clean that filters. So what are the problems can we have? Can be occur, like generally peak can be deformed due to various reasons. Like sometime peak broadening is there. So it can be due to the sample overload, or like you are having a saturated peak is there. So that is due to sample overload. So how we correct that? To reduce the sample injection volume or concentration. Inappropriate sample solvent. Sometimes you are not getting the peak, or you are getting a different shape peak. So inappropriate sample solvent is there. It is not get ionized in the sample. The sample is not gonna like moving into the mobile phase. So ionization sometimes required. So you should have a particular solvent system, or like if you are having some non-polar compound and your river phase system is there and you are using a water as a solvent, so you will not get the peak. So you should use some organic non-polar solvent like a, or less polar solvent like a ACL. So use that and you will get the peak. So solvent selectivity is important. You are getting some due to dirt, you will get the peak deformation. So that dirt can be removed by the rinsing the column. Gap in the column inlet. Column inlet is not connected properly. That will also help in generating dead volume, and that dead volume further help in peak deformation. So repair that column connectivity. So what are the other things that can decrease in retention time? Typical problems that lead into a decrease in retention time. Maybe due to eluent composition. Maybe your solvent is you should check that, like you are having a highly polar molecules are there and you are using water as a maximum concentration. Then your RT is shifted to lower side and it will be merged together. So you should check the eluent composition. Flow rate. As we decrease the flow rate, elution will be slow and separation of the two peaks are better. So always check the flow rate. Column temperature, already I discussed. Column temperature can also affect the separation of two molecules. Now why baseline is drifted? Maybe there is a lots of factors which affect the baseline drift. Maybe it is due to there is a you have some bubbles in your mobile phase that lead into a drift from the baseline drift. So you should remove the column and first you degas the system and clean the system. Like you can do the purging. There is the two things are always there in the HPLC: cleaning through the column wash, or there is a through purge. Purge is generally it is running of solvent without the column. You just pass through the pump and it will go to the waste. That is a purging. You through the pump and auto sampler, it is goes to the waste. So that is a purging. You can do purging. And second is your washing. You are completely rinsing the system. Like your mobile phase is coming from the mobile reservoir going to the pump. degasser, then autosampler, then column 1, then detector, and goes to the waste. So you should do rinse through cleaning, full cleaning, as well as through the purging. That can help in minimizing the baseline drift. Another thing you can have to protect your column, use guard column or pre-column. That can help in protection of column from the damage. Now, how we can rinse the column? So for the rinsing, you should use a column solvent which is having a high elution capacity. Then to remove basic substance from the river phase, you should use acidic solution and an air pair reagent to remove basic impurities. To remove hydrophobic substance from an ion exchange column, add an organic solvent. So these are the some things, some points which generally used to clean or rinse the column. Otherwise, for the if your column is not performing well, so you can perform this different rinsing technique that will help in regeneration of your column. So how we can regenerate your RP packing? Generally, RP columns like C18, C8, C4, C1, C13, cyano, column. So first of all, flush the column with a 20 column volume water. Then flush the column with the 20 column volume acetonitrile. Then flush the column with the 5 column volume isopropanol. Then flush the column with the 20 column volume heptane. Then 5 column volume isopropanol. Then further with the 20 column volume acetonitrile. So this is a technique for regeneration of RP packing columns. And for the normal phase packing columns like silica, diol, nitro, amino, stationary phase columns, first of all, heptane is used 20 column volume, then isopropanol 5 column volume, then we are using acetonitrile further 20 column volume, water 20 column volume, acetonitrile 20 column volume, isopropanol 5 column volume, then last does it 20 column volume heptane. So generally this is a technique to regenerate your column further. So or you can also done through reversing the column and run this mobile phase over this. So that can help in the regeneration of your column. So this is the same thing like how we regenerating or cleaning the column. Mobile phase like this, different solvents are there which can be used for the cleaning of column. Now storage, generally it is stored in ACN. It should not be dry in condition, and we should use column and rinse the column, then we should store that. Now the last thing about my presentation, like troubleshooting, what are the various problems we faced day to day HPLC problems we generally faced, and how we correct it and how we minimize that. So what are the problem can we have, like a pressure abnormalities, leaks, problem with the chromatogram, injection problem, and other things, and how we correct that. So let's discuss first by one. Abnormal pressure, how we check that? Generally, what are the reason for the abnormal pressure of the system? Maybe due to power off, fuse blown, controller setting or failure, broken piston, air trap in pump head, insufficient mobile phase. That is insufficient mobile phase can be there, like we generally forget to check how much mobile phase is there. So that can be the reason. Maybe some leakage is there in the system. So these are the major possible causes for the abnormal pressure. So solution, same, turn on the power, replace the fuse, verify the proper setting, replace piston, check the solvent, tighten the fittings. So these are the basic solution for the pressure problem. And second is, in this pressure, there is a no pressure reading or flow is normal. So flow is normal, but you are not getting the pressure. So what are the major possible causes of this? Faulty meter. You have faulty meter, faulty pressure transducer. So solution is simple. You should replace that. Next, very important in pressure, like if you are getting high pressure, generally it is happening. Like whenever you are using a continuous HPLC, you will get the higher pressure. So what are the reasons? You have set the high flow rate. Flow rate, as you increase the flow rate, you will get the higher pressure. Blocked column freight. Your column freight is blocked. That will lead into a pressure. The system is require more pressure to passing the mobile phase. So if it is blocked, so you will get the higher pressure. Improper mobile phase, precipitation is there. So that is the another reason. Improper column. You are using a not exact column according to your HPLC. So you will get high pressure due to that. Packing material of the column is also important. It play a very important role in pressure of the system. So if you are having a particle size of column packing is very small, then you will have high pressure. So that is another cause of the high pressure. Injector blockage, column temperature is too low, that also lead to a high pressure. Controller malfunction, blocked guard column, blocked inline filter. So what are the possible solution for this? Check the freights, correct the mobile phase, clear the blockade, raise the temperature, use guard columns, replace inline filters. These are the possible solution for this. And another is low pressure. If you are getting a low pressure, so how we can correct that? Maybe possible cause of the low pressure is flow is very low. That's the reason. Leak in system, improper column temperature too high, controller malfunction. So solution, adjust the flow rate, locate leak and correct, use proper column, lower temperature, repair or replace controller. So high temperature or lower temperature generally is happening due to some leakage, blockage. So you should check that. As well as that temperature is play a very big role in that. So you should check the temperature also. So pressure dropping to zero. This is due to generally you are having your pump is not working properly. That's why it is zero, right? So these are the some pressure related problem. There is a pressure cycling problems are also there, which is generally due to air in pump, faulty check valve, pump seal failure, insufficient degassing, leaking system using gradient elution. So how can solve that? Degas the solvent, replace pump seal, degas solvent. So these are the corrective measures for this pressure cycling. Now the leakage issues. So there is a leak in fittings, leak at pump, injector leak, column leak. So these are the detector leaks. So these are the some leakage problems are there which hinder your separation. So you should check where is leakage is there. If there is a leakage in the fitting, you should tighten that or replace it. Leakage in pump, you should check the tight fitting. You should check valves, tightening the fittings, or check the tubings. If you are having a leakage in an injector, check the injector rotor. That will help in removing this issue. Column leakage generally due to the fittings and all, so you should check fittings only, right? Now the major problems which is you found in the chromatogram, like peak tailing. Your peak is showing tailing. It is eluting slowly. So what are the possible reasons for this? It is due to blocked frit. Your frit is blocked. Column void. Having some dead volume. Interfering peaks. Due to the peaks, mobile phase is not able to eluting the system from the column. That is another reason. Sample reacting with the active sites of the column. So that is another cause of this problem. So solution: flush the column first. That will avoid the void spaces. Use longer column. Use proper mobile system to elution of the peak. So these are some measures for the peak tailing. Peak fronting. You are getting a peak fronting of peak. From the front, peak is so broaden one. So the reason generally low temperature, wrong sample solvent, sample overload, bad column. So solution: increase column temperature, use mobile phase for injection solvent, decrease sample concentration. So these are the major solution for this. Split of peak. You are getting a splitting of peak. So reason: contamination on guard column or analytical column inlet. Second, sample solvent compatible with the mobile phase. Incompatibility with the mobile phase. So your sample in which you are solvent which is used in your sample, which is incompatible with the mobile phase, can lead to a splitting of peaks. So solutions: you should remove the column or the guard column or change the column and change the solvent. That is the best thing you can do for this. You are getting a distorted larger peaks. It is generally due to the sample overload. You are having the higher load, that's why distorted peaks are there. So you just reduce the sample size, you will get the good peak. Distortion of early peaks. Wrong injection solvent. So that is the main reason for this. So reduce the injection volume and use weaker injection solvent. So that can solve this problem. So other thing like tailing early peaks more than later one. So it is generally due to extra column effect. So how we can correct this? Change the column or shorter column can be used, right? So that lead to solve this problem. So you will get a further like peak problems like are there acid called basic peak tails are there. So inadequate buffering is there. So use a buffer with the 50 to 100 millimole buffer concentration. You will solve this problem. You are getting extra peaks generally due to the impurities or some last compound peak is there. Late eluting peaks from the previous injection is there. So you can just check your sample and flush your system and column. You will solve this issue. So baseline, you were facing a problem with the baseline. So there is a column temperature fluctuation, can be is a non-homogeneous mobile phase, contamination or air buildup in detector cell, plugged outer outlet line after detector, mobile phase mixing problem. So these are the some possible causes of baseline drift. It can be corrected by control column and mobile phase temperature. Use HPLC gradient solvent only. Flush cell with the methanol or other strong solution. Unplug or replace lines. Correct composition or flow rate. Flush the intermediate strength solvent. So these are some measure for this. You are getting a baseline noise. So that is a major, most common issue with the HPLCs. So that is generally due to air in a mobile phase, detector cell or pump, or you are having some leakage, or incomplete mobile phase mixing. Mixer or mixer is not working properly. High temperature can also lead this. So these are the major causes of this, and how you can correct this: degas the system, check the leakage, mix mobile phase by hand or by your automated system, reduce differential or add head exchanger, and you should have a proper pulsated pump that can help in that. So similarly with the baseline noise, it's kind of this only. Broad peaks is another issue with the HPLC. Possible cause: you have changed the mobile phase composition abruptly. Mobile phase flow rate is too low. Leaks are there. Detector setting incorrect. Extra column effect. Compound is more absorbing over the stationary phase. So these are the major causes of broad peaks. So prepare new mobile phase, adjust flow rate, adjust the setting of detector, flush the column, use guard column. So these are the measures can be used for the solve this problem. Like you are not, so these are the other few other things like a loss of resolution, all peaks too small, all peaks too large. So generally these are due to some contaminated solvents, or due to some your sample preparation tech is not proper. So you can check that your detector is not working properly. So you can check that. Okay. So these are the few other problem related to injector. Manual injector hard to load. So grease that, change that manual injector. Your auto injector is not working. Auto injector with the showing some blockage. So you can correct by changing or cleaning the all these injectors. Okay. So these are the troubleshooting problems which we generally have in the HPLC system. And if you talk about the HPLC further, like this, I'm using this HPLC, which is a Shimadzu HPLC with the lab solution as a software. So like this software is visible. Hello. Hello.
So your screen is visible, but not software actually.
Okay. Okay. Like there is some parameters are there. There is a flow rate in this. There is a like it can goes up to the 10 ml per minute, from 0.1 ml per minute to 1 ml per minute, 10 ml per minute. So you can like according to your analysis, you can set the flow rate here. Then there is a options are there, like it is a quaternary HPLC system. In this, we can use a four solvent simultaneously. So there is a 4 different options are there for solvent A, B, C, D. You can choose the concentration of solvents here, like you can choose 30% A, 70% your B solution solvent, and you can use that. That is the isochromatic technique. Then there is a temperature is there, like you can set temperature from 20 degree to 60 degree in this machine. So like I have set it here like a 30 degree. So these are the few parameters which generally used before setting a method for the analysis. So another thing, like it is having a LCMS time program that is used for the gradient technique. Like you are setting a temperature from your solvent concentration from like at 0.01 minute 5% ACN, 95% water. 10 minutes you are increasing ACN to 30%. Then at 25 minutes you are increasing till 70% of ACN. So like this is a gradient. For 45 minutes you are increasing ACN from 5% to 90% and decreasing further to 5%. That is a gradient technique. So you are using this software for setting your method. After you set the conditions, you just save it and save according to your like analysis, or you can give your name, anything. After that, you just check the things like first of all, these are the solvent reservoirs in which there is a different solvents are there. Like from A, I am using water with the 0.1% formic acid. B is ACN, C is methanol, and D I have a isopropanol. So this before using this solvent, I always degas and sonicate with the sonicator at least for 30 minutes and filter it with the from the filtration assembly. And I always used HPLC grade solvents only, right? And it is also having in this, they always having some filters inside it, and these filters help in preventing any particle which is in the solvent cannot enter into the system through the tubes. So always filter should be there, and these filters should be clean at least in a month or 2 months through the like ACN as well as 0.1 like 1% nitric acid. You can use that, right? Then you are having a this is a pump. This is a pump which is there. This is a quaternary pump which we are using here. And this is a degasser, which generally pumping out the solvent from the reservoirs and degas with the degasser and goes into the further system. And this is a auto sampler which is used here. Like this is the auto sampler, and we are using a different vials for this. And this before using this, we prepare the sample with the solvent in which compound is solubilized completely and filter it. Then we are having this is a column temperature, column compartment where column is placed. This is a column, silica octadecyl C18 column, which is used. And after setting the method, solvent is passing from this and goes to the column and goes to further detector. And this compound is temperature maintained. You can set the temperature from 20 degree to 60 degree. So according to your method, you can set the temperature. This is a detector. This is a detector, PDA detector we have, and this detector is using for this purpose for detection of compounds. And we also have in this machine fraction collector. and this fraction collector is used further for the separation of different peaks for the isolation purpose. Even you can use manually. You can collect directly from this waste tubing. You can get the separated molecules. So this is the overview of the machine which we are using here. And like you just first of all you have to set your method according to your analysis. So in this you have to choose your correct solvent, correct column. Like I have this is another column which is a 5 mm dia. I'm using here 10 mm dia column, and I also use different like cyano-phenyl columns for the analysis of different compounds. So you have to choose a correct column, correct mobile phase, correct buffer before analyzing your sample. After you selected the column mobile phase, you just set a sample or set a method. After setting a method, you will run the system and you are getting the peak. If peak is in right shape, you can say like you are having a correct method, and you can adjust the retention time according to your analysis. How many compounds are there? So you just first of all set the method. After the method set, you just choose what kind of analysis you want to do, qualitative analysis or quantitative analysis. If you want to do a quantitative analysis, then you have to make a batch where you have to use a different concentration of standard and sample and just run that, and you will get the quantitative data through the processing of that obtained analysis. So this is the overview of HPLC we generally use in our lab, and this we face many troubleshooting issues like we already discussed. So we can correct that by just applying some troubleshooting, problem solving. Like you just check what are the problems, like rinsing issue is there or some fitting issue is there. So you can correct that. So this is about the HPLC and about the system of this lab. So any question you want to ask, it is free. And thank you.
So there are some questions like, can we reuse the solvent mixture coming out of HPLC column after distillation in HPLC again?
After running a sample, the waste solvent.
Yes.
No, we cannot use. Like
Okay.
you first of like if after running your sample, your waste solvent is having a your impurities. So if you are going to further use, first of all, you have to extract it out first and remove that. So there's a lots of work. So you cannot use reuse the solvent.
Sir, another question is, which type mass detector is generally used in bioanalysis?
Generally, ESI triple quadruple LCM is generally used. Other than this, if we want to go for the high resolution, then HRMS QTOF can be used. But most of the cases, triple quad is ESI mode system is enough for the bioanalysis.
So one question is related to some calculation parts. So the participant want to ask a suggestion for any book which can help him to solve the problems related to calculation in the theoretical field.
So like there are lots of books are there. There is a village one book on HPLC. You can use that. Otherwise, in Indian author, like there is a Chatwal is there, in which calculation part is there, so you can use that. Otherwise,
So,
there is a village book. Lots of village books are there, which is giving good information related to HPLC.
So one question
Otherwise,
is,
anyone needs some data, I can share that.
so one question is, what are the spectroscopic methods we should know to run HPLC efficiently?
Sorry, can
What
you
are
repeat?
the spectroscopic methods we should know to run HPLC efficiently?
You should know most of the system PDA based HPLCs are used, so you should know about the how the PDA is working, or if you are using a LCMS, so what is the principle of mass spectroscopy? So that will help in your understanding the HPLC. Like similarly, refractive index. If you are using a RI detector, so how that principle of refractive index is there, like for ELSD. So relating to detector, if you have knowledge about detector, it will be easy for you to understand the chromatogram.
Okay. So one question is there any need to heat the solvent for washing the column?
Yes, actually sometimes there is a choking is there, or some particles, or some you are using a HPLC continuously, your previous samples, uh, uh, some parts is there left inside the column, so you should use heated, like you can heat the solvent like a water at a temperature of 50 to 60 degree, and run with the system, and it will help in the cleaning of the system. So generally it is a routine practice of any analyst that it should run the heated water through the HPLC to clean the system.
So, sir, that's all about the questions. Thank you, sir, for such a wonderful session. We are grateful for the effort and time you took to share your knowledge and experiences. Thank you for your contribution.
Thank you. Thanks a lot.
So now it's time to move on to our third session. I request all the participants kindly wait for 5 minutes and we'll be starting soon.
Yes, within 5 minutes we will be starting.
It's 3:37 p.m. To hear your notifications, follow the notification on your phone to turn on notification access.
Hello, am I audible?
Yes, sir. Sir, you are audible.
Okay. So I shall start now
Yes, sir. Okay.
my session. Okay.
Rupali madam,
Yes, sir. Sir, we are
kindly
starting.
introduce.
Yes. Yes, sir. So we are in the last session of day one, that is session third. And I would like to introduce our speaker of this third session, that is Dr. Surjit Debnath. Dr. Debnath currently is the head Department of Medical Laboratory Technology, Women's Polytechnic, Tripura. With more than 13 years of experience in biomedical research and high-level teaching, Dr. Debnath is participated in various academic work in institutions of Germany, Denmark, and Hong Kong. Besides its premier India labs such as AIMS Cytogenic, IIT Kharagpur in Biotechnology, IIT Guwahati Biomedical Engineering, NBPGR Plant Genomics. Dr. Debnath is the recipient of Young Scientist Award from different agencies like DBT, DST, and CSIR. Recipients of Tata Trust grant for CME course in Royal College of Pathologists, London. Reviewer of several Scopus ACI Index journal published by Elsewhere, Springer, Biomed Central. Along with regular academic activities, he is also engaged with several biotechnology companies in Northern and Western India as a consultant. He have conducted various workshops and talks, acted as session chair in the international conferences sponsored by national and international academic agencies. He delivered numerous invited talks in national and international academic gatherings. Currently, he is guiding a group of international students for their internship from Russia, Turkey, and West African countries. Dr. Debnath also filed 2 patents in 2021 in India on biotechnology. So it's a privilege to hear you, sir. Over to you, sir.
Okay. Thank you for the introduction. So we shall start the session now. Okay. Okay, great. Okay, so our discussion for today is peptide-based therapeutics and how protein engineering can help in to design a therapeutic peptide with the desired traits. And while discussing this particular point, we'll also try to explore various analytical tools, research tools, which will enable us to do so. We'll also have some discussion on what are the therapeutic peptides that are available today and what exactly we can do in order to enhance their potency. So when we talk about peptide based drugs, these are 3 different specific broad varieties of this kind of drugs. One which are using for diagnostics, that also in bioimaging and biosensors. So peptide based molecules or proteins which are being used in diagnostics through enabling us for bioimaging as well as biosensors. Now, when we talk about bioimaging, we are essentially, most of the time, we are talking about fluorescent-based diagnostics through engineered antibodies, for example, in Western blot and several other cases. This is also true for fluorescent in situ hybridization and all such things. Wherever we use some kind of fluorescent tag, we are talking about this. Many a times, these fluorescent tags are nothing but peptides or composite peptides where there is a peptide based part and there is a non-peptide entity as well. In diagnostics also, one more very important aspect is biosensors. Again, a very important aspect of peptide based pharmaceutical product where, for example, the glucose sensor that you use as glucose strips for domestic glucose estimations and all, which also employs several enzymes. One such enzyme is cytochrome oxidase, which has been isolated from Pseudomonas, an aerobic organism. So this is the most frequently used enzyme in all biosensors that are developed today and available in the pharmaceutical market. Then there is therapy. Now, when we talk about peptide-based therapy, there are plenty of it, as you already know. However, our main focus today, that means that today's fraternity is mainly involved in three major types of therapy. That is regenerative medicine, then cancer therapeutics, and anti-pathogenic drugs, which are peptide-based. Then there is one more important aspect, that is drug delivery mechanisms, where various kinds of peptides are being used for as a delivery vehicle and things like that. Now, one more important aspect that has been developed recently, that is theranostics. In theranostics, what happens is therapeutics and diagnostics are taking place hand in hand. For example, if there is an engineered antibody which can specifically identify a particular kind of cell where there may be some specific differentiation and where a cancer is being developed. So what this particular antibody based molecule, what it will do is it will not only identify the cancerous cell, it will also deliver a therapy there. So what happens is diagnostics as well as therapeutics are getting combined for better patient compliance. ऐसा ना हो कि patient को बार बार जाना पड़े, एक बार imaging के लिए जाओ और एक बार therapy के लिए जाओ. So the idea of the pharmaceutical industry is that to combine both, so that the diagnostics as well as therapeutics will be done hand in hand. So this is also has been some very good examples. For example, thyroid cancer, where the radioactive iodine is given not only for therapy but also for imaging also. So this is how these therapeutics and diagnostics can play a vital role altogether. So out of this, there are some specific examples which the pharmaceutical companies and the pharmaceutical industry has embraced in a significant way. For example, like therapeutic antibodies and then immunotoxins. So there are very good examples. Let me give you some specific examples which has been blockbuster drugs. For example, rituximab. Rituximab is the brand name of a monoclonal antibody which was initially designed in order to treat autoimmune conditions like SLE, systemic lupus erythematosus. But however, there has been a repurposing of this particular drug, and today you will be amazed to know that it is also given to adolescents and very young age patients who are suffering from nephrotic syndrome and glomerulonephritis kind of thing. So, as all of you know, that drug repurposing is a big thing today. So this is a very good and common example. One more example of a therapeutic peptide is this herceptin, which is being used for treatment of what do you call as breast cancer, where the specific therapy has given excellent results. Now on the right hand side, there are several growth factors and signaling molecules, which would be the interleukin-2, the common one. Then there is EPO, erythropoietin, which is being given to patients who are suffering from kidney disease and who are under dialysis and completely got rid of their kidneys. And EPO is very, very important for maturation of RBC. And therefore, what happens is there is a desperate need of this particular drug, and which is not possible to isolate from human being, and therefore genetic modification and genetic engineering is being done in order to produce a lot of EPO or erythropoietin, which is being sold as a drug. Then there are several good examples. For example, interferon gamma, a very good example where in India, PGI Chandigarh has been excellent in this particular application, and now for hepatic DNA viruses, for example, hepatitis B and C, interferon gamma is significantly in use and has given excellent results, and today it is under conventional regime of treatment of hepatitis DNA viruses. And these are some examples of therapeutic peptides which and diagnostic peptides which are available today. These are some more specific and less common examples of this kind of peptide based drugs. So how these peptide based drugs should be analyzed? So the purification part is one thing. Then second part comes is the processes that are used for to identify their potency. Now, in order to analyze the potency of these drugs, most of the time these clinical trials are being done, and that means these are in vivo studies. Other than that, there are several in vitro mechanisms through which we can analyze the potency of peptide based drugs. And one more group of very common peptide based drugs are the enzymes and catalytic proteins, which are there is a huge market in India because due to some reason the Indian patient population is such that they have an inherent inability to digest a good amount of food, and therefore indigestion and dyspepsia is a common thing in Indian population. And therefore the pharmaceutical industry is exploring this particular opportunity and makes huge profit by marketing of enzymes and kind of therapeutic things which are available today. For example, the best example could be the example of amylase and pepsin, which is very common. If you go to a shop, you will get pepsin and these alpha amylase combinations which are available today. And many pharmaceutical industries are marketing these products in a huge way. So how do we exactly analyze their potency? So mostly we do in vivo studies, and some in vitro analysis is also there. For example, analysis of enzyme kinetics, whether these enzymes are working in a proper way or not. But finally, because these are peptide based drugs, the final analysis is generally done by the structural studies of these enzymes, which involves several things, including X-ray crystallography, then surface plasmon resonance, and so many other things. Other than the purification process that you have already had some idea that how these peptides are being purified. For example, if we give the specific example of amylase and pepsin, which are being produced by substrate solid state fermentation of several fungi. These are usually produced by several fungi strains, and these are batch cultured in a solid state bed, solid substrate bed, and then the enzyme is being released in the medium itself, and from the medium that should be purified. Now, this purification process comes in two steps. In the first step, these enzymes, the common one, the pepsin and amylase, these two enzymes are being purified by conventional methods. For example, solvent extraction is a very common method through which a large scale separation as well as purification of peptide based materials can be done. Now, there is a disadvantage of this what do you call as liquid extraction. So what happens is there is a large part which is getting lost because these are very rigorous treatment procedure. So one more very efficient and very useful process for purification of these peptide based therapeutics are dialysis, where through by means of a membrane these particular proteins are getting separated. Now, these are only for those cases where there is a large volume of the target protein that we are talking about. For example, amylase and pepsin. But this is not the case for those proteins which are usually made by recombinant DNA technology. For example, lipase. So lipase is also one more very frequently useful, and there is a huge market of lipase also in India for mainly malabsorption syndrome patients and patients suffering from critical conditions like pancreatic insufficiency, as well as cystic fibrosis in some cases. This lipase, which is useful for absorption of fat and fat soluble vitamins, is a very important pharmaceutical drug. And now this drug, the problem with lipase is that unlike amylase and pepsin, it cannot be produced by mass culture, and it cannot be produced by solid state fermentation. So it should be produced from this thing only, recombinant DNA technology. So it is nothing but the similar technology that is that we use for production of human insulin for diabetic patients who usually take insulin as an injection. So initially also, when recombinant DNA technology has not developed in a significant way, at that point of time, the lipase was being isolated from pig pancreas. Now what happens is the lipase isolated from pig pancreas had a similar ability to digest fat and emulsify fat in a significant way, but there was a problem of some kind of impurity which caused a lot of allergy and hypersensitivity reactions. So when these conditions become very frequent in India as well, then the pig pancreas based lipase was this thing discontinued from pharma market, and then it replaced by recombinant DNA technology. In these cases, what happens is the lipase is being used, being produced from recombinant DNA technology and subsequently purified through various methods such as, for example, affinity and then ion exchange based chromatographic methods.
Sorry to
Coming
disturb
to
you,
the
sir.
next couple of
Excuse me, sir.
examples.
Excuse me, sir.
Uh-huh.
So your slides are fixed.
Uh-huh. Yes,
actually,
go
they are
ahead.
not moving. So your slides are fixed. They are not moving. Your slides are fixed at just front page.
Why is this so? But in my this thing, it is all moving all the way. So why this is happening? I'll just refix it, madam.
Okay, sir.
I'm very sorry that has happened. If I have crossed several parts, I'll just check it out once again. So I'll stop sharing. Oh, just hold on. So is it moving now, madam?
Yes, sir. But sir, your slide
This
is
was
very. So it
the.
is very short. I am unable to see it properly. I'm not getting whatever it is written on the slide. Yes, now it's okay, sir.
Okay, so this was the thing that we discussed, that peptide-based entities can be used for diagnostic, therapeutics, and drug delivery. Okay, so now the slide is changing.
Yes, sir.
Okay, Professor Janaki Patel, would you please change your hand that it is being shown? I think she has raised her hand. So is it okay now? It is changing, right, madam?
Yes, sir. It is changing now.
Okay, now these are some specific examples that I have discussed. I did not know that it is not this thing, because from my end everything was okay. Anyway, I'm sorry for it. Now, these are some specific examples of engineered antibodies and several other proteins based therapeutic things that are available today in the pharma market. Now, these are some more uncommon examples, but frequently used. Then these are there are some specific examples of enzymes and catalysis and catalysts. For example, as I have said, the examples of pepsin and alpha amylase, and subsequently we have also spoken about the recombinant DNA based products, that is lipase, which is not, we cannot able to what we call as make lipase through solid state fermentation, and therefore we need to depend on recombinant DNA technology. So can you able to see the slide which talks about preclinical and clinical things, madam?
Yes, sir. It's visible,
So
sir.
this is the pipeline so this is the pipeline that was usually taken for approximately 10-year timeline was needed in order to develop a vaccine. We are just talking about, for example, if we start the concept in 1996, on 2006 only, we could have completed the, what do you call as the second phase of clinical trial. So it means that there is approximately 12 years of work which is needed for developing a peptide therapeutics in the form of a vaccine. But recently, as you all know, that within 1 year, we have able to generate vaccines, several industries, several companies against COVID-19. So how these things has been possible? This has been possible to a significant extent due to some technological improvement, mainly in analytical as well as research tools, as well as some tools which are based on prediction and simulation. So we shall be talking about all these things. Instead of 10 years, 12 years, now we can able to produce a functional vaccine within a year and so. So these are all possible today. Now, these are some considerations before we market a peptide-based drug. This particular slide can be shown, madam. Is it visible? Consideration of peptide-based therapeutics.
Yes, sir. Yes, sir.
Okay. Okay. So what happens is these are some considerations that should be there. That there would be reduced antigenicity. So previously, what has happened? We used to take pig pancreas from slaughterhouse. Then we used to homogenate the whole thing, and then we used to do some differential filtration. So in that case, what has happened is, for example, a liquid extraction we would have done, and the protein part would have come in a particular phase, and in the aqueous phase, the rest of the other things were there. So we will get rid of the aqueous phase, and then once again we will do the liquid extraction several times, and then finally we will isolate the protein. That is the lipase. Now in that lipase, we will do a little bit of HPLC or things like that, so that all the impurities are this thing. We got rid of the impurities, and then subsequently we used to market it. But it has been seen that there has been some cases where the lipase of pig origin or swine origin was not well tolerated in human being because of the issues of antigenicity. So if we are designing some kind of peptide therapeutics, we should ensure that there is reduced antigenicity, and there should be significant biocompatibility as well. And then biodegradability rate is also very important for case of peptide based drug, which is somehow in concept similar to the this thing of bioavailability of small molecules, that is inorganic and organic drugs and medicines. Then there is a very important consideration, that is cross signaling. So there should be minimum cross signaling. Let me give you one example. in geriatric patient, there is a very common condition that is called bed sore. Okay, so bed sore is nothing but some kind of skin ulcer which develops because of the constant pressure on a particular site on the skin. Okay, so what happens is they cannot able to repair this thing due to the old age, and these patients suffer from a lot of bed sores. Now, the very good medicine that is available today's market is the brand name is Placentex. Now, Placentex is nothing but the homogenate of a animal placenta, and in that placenta several growth factors, including fibroblast growth factor, then epidermal growth factor. These are all there. So what happens is whenever there is a bed sore and the ulcer that is not getting resolved easily, at that point of time, what you should do is you should apply this Placentex cream, which is nothing but an extract of animal placenta embedded in a hydrogel. So what the hydrogel does is hydrogel enhances the stability of the peptide, because usually what happens is these peptides are very complex in nature. These growth factor proteins. So this hydrogel is making some kind of barrier so that the environment do not degrade it so rapidly. So when if you go to a shop, you can ask for the Placentex cream, which is available in all shops. So that is a very good this thing of peptide based drugs, and the stability of the drug has been modified by making it into a matrix, which is usually done. Now the problem with the growth factor is that, so whenever there is some kind of cancer, now in cancer what happens is there is a generation of new tissue. Now during the generation of new tissue or development of the what do you call as the tumor, then also a lot of growth factor is being produced. For example, if the new muscle around the tumor is developing, so fibroblast growth factor will be there. So what happens is your growth factor, for example, you are designing a drug which contains a specific growth factor. So you should also take care of this kind of cross signaling. So what will happen, instead of repairing your tissue damage of the patient, if it can go and give rise to a skin cancer for the patient, it is not very anticipatory goal of the doctor, isn't it? So all kind of things during peptide based therapeutics, which my lab is interested in, and I insisted on this particular topic in this particular session. So what happens is for peptide based drugs, cross signaling is also a big issue, that you are anticipating the peptide to do something else, but it is doing something different from your anticipation. So accordingly, you have to do enough protein engineering, and then you have to modify the behavior of the protein, isn't it? So these are some considerations that should be there. Now these are some very good examples of peptide based drug engineering, okay, or peptide engineering or protein engineering as such, where a significant amount of patent has been generated by several pharmaceutical companies. Mostly these are in Western Europe, and I had an opportunity to interact in these scenarios where this protein engineering is a regular practice in these areas, mostly in Scandinavian and Western European countries. Companies like Novo Nordisk, which is producing the highest amount of human insulin throughout the world. In fact, they only the company which had the patent for human insulin by using recombinant DNA technology. So these are some examples of peptide-based drugs developed through protein engineering. So our lab is also interested in peptide which are catalytic in nature. Now this is a very simple representation of the activity of an enzyme, and since most of the participants are teachers by themselves, so we need to handle this kind of this thing if it is there in our syllabus. Many clinical chemistry syllabus comprises of this concept, where a nice stick has been shown, which the product is broken stick. So from the reactant, which is an intact stick, how we reach to our goal, that is a broken stick. In between, if you want to break the stick, you need to invest a lot of energy. But in a physiological system, instead of using energy, what we'll use is we'll use an enzyme. So what it will do is it will reduce the delta G needed to produce the product, and therefore at room temperature only you can bring about the desired change by using this particular peptide. But the problem here is several times it may happen that your peptide is not very stable. As I have said, that epidermal growth factor and fibroblast growth factor, which are very good drugs for tissue repair and regeneration. But the problem here is they are not very stable. The shelf life of the medicine is very low, so which is not very desirable for a pharmaceutical industry, isn't it? The pharmaceutical company would like to have a medicine which is having very extended expiry date so that it can be promoted for a large period of time. Now, Placentex, the cream, as I have said, which is usually given for treatment of bed sores in geriatric patients. So it's how they have increased the shelf life by embedding the whole growth factor composition into a hydrogel. So there are several aspects that how you enhance the stability of the peptide. Now there is one more thing, that how you will determine whether your peptide has been deteriorated or not. What are the different analytical tools through which you can find out whether your peptide based drugs, for example your insulin, आपका जो इंसुलिन है जो आपने परचेस करके लाए हैं, whether it is having its validity or not, how you will determine. So there are several processes for it. For example, in R&D, what usually they do is they take a batch from a batch of all synthetic drugs, that is the therapeutic proteins. They will take 1 or 2 sample and do the sequencing. So protein sequencing can be done in order to understand whether the protein has been deteriorated or not. So protein sequencing is a very good analytical tool in order to find out whether your peptide based drug has still be intact. Because if the protein sequence is incomplete, it will definitely tell you that your protein is not complete and therefore your protein is not good anymore. And if you inject that deteriorated protein, the patient will not respond. On the other hand, the patient may go into a coma due to the hypersensitivity or allergy, which could definitely deteriorate the condition of the patient. So, but in all labs, you cannot expect to have a protein sequencing technologies, which needs a lot of skill as well as investment. So what they do is, these companies, they will take one sample from a batch and they will sequence it, and after the sequencing thing is done, then only they will find out whether the protein is intact or not. But there is a problem with protein sequencing tools as well. So let me tell you this. So what happens is, if you do protein sequencing, you will get an idea that whether your protein is intact or not, isn't it? Because proteins, as you know, is made up of long chains of polypeptides and long chains of amino acids. If the amino acid sequence is complete, so it means that your protein is intact. But there is a second aspect of it, isn't it? What is the second aspect? The second aspect is the three-dimensional conformation of the protein. Because what happens is, the primary structure of the linear sequence of the amino acids in the protein is important. There is no doubt in that. But one more thing is also important in case of proteins. As we have already given you examples of catalytic proteins, like what do you call as lipase, amylase, and things like that, including human insulin also, which is also a wonder drug and a blockbuster drug for the pharmaceutical industry. So what happens is, if your protein sequence is intact, it can also still become unusable. Why? Because it may lose its three-dimensional structure. So there are two aspects of protein analytical thing. So I'm not only talking about the purification process. The purification process involves several analytical aspects, as you know. But the maintaining the quality or the quality control aspect of your therapeutic protein will be bit different from the other non-protein based drugs. isn't it? So in this case, you cannot just simply use chromatographic tools in order to identify whether your protein is maintaining the sufficient quality. So what you need to do, there are several tools which is used for analysis of protein quality. Some tools, for example, like Western blot. So Western blotting is a method through which you can analyze whether your protein is maintaining its epitopes, that is the structural integrity that is on the surface but not inside. So for example, you are using or you are dealing with a drug. For example, if you are a quality control engineer of a particular company and you are looking towards a drug which is a protein, but it's a functional domain that we call three-dimensional motif, which is somewhere embedded inside, not exterior. So if it is not exterior, so Western blotting cannot help you. So in that case, you need to use X-ray crystallography in order to visualize whether the internal structure of the protein is intact. So if we list out for our students that what are the analytical tools and techniques that are needed for peptide-based drugs. So there will be a paradigm change because it will be completely different from usual what we call as pharmaceutical APIs or active pharmaceutical ingredient, which are usual drugs and medicines. So it will be different. For example, initially you may have to use what you call as simple tools like SDS page, sodium dodecyl sulfate polyacrylamide gel electrophoresis, in order to understand whether the molecular weight is there and whether several other impurities are there or not. So once you have done away with your SDS page, then you may go to a two-dimensional electrophoresis where you will find out that if the protein is maintaining its isoelectric pH or not. Isoelectric pH, a very important what we call as a parameter to judge whether your protein is still maintaining its noble structural format or the electrical landscape, because each and every protein has a specific electrical landscape which is determined by the surface residues that are there. So we'll discuss a little on these also. So 2D gel electrophoresis can help you. Subsequently, if you are only looking at the surface on the protein, then you should go for Western blotting. But if you are looking into the interior of it, so which kind of tools and technique you should use? You should definitely use X-ray crystallography. Now, X-ray crystallography is a very, very skill-intensive method. You cannot able to do X-ray crystallography for each and every batch. So what do you do is, you take a single sample from a large batch, and then if your X-ray crystallography is intact, you may consider that your protein is also intact. So for example, drugs like vaccines, where you cannot take any chance in countries like India, where your preservation mechanisms are compromised several ways. For example, if you are going to an interior part, it may happen that you will not have a proper refrigeration facility. So how you will determine that your vaccine is functional and it will preserve its activity and it will not cause any allergy or any antigenicity? How will you determine? You will determine by these kind of quality control checks, very high-end checks, quality control, for example, X-ray crystallography and things like that. And then comes the method of protein sequencing. So in protein sequencing, what you should do is, you should do specific reactions of today. Several mass spectrometry is also available. For example, MALDMS, matrix assisted laser desorption mass spectroscopy or spectrometry, through which you can understand that whether your protein structure and sequence is intact or not. So these are some tools and techniques that are useful for what you call as peptide-based therapeutics, bit different from other therapeutic things which are inorganic or organic salts of some kind. But one more problem that is handled by peptide-based drug companies is enhancing and or maintaining stability. क्योंकि क्या होगा, आपके पास अगर एक inorganic salt है So usually what will happen is you will definitely have a extended period of time, isn't it? If you put it in a brown color bottle, or you put it in a blister pack, or you preserve in a particular temperature, your salt is preserved. But you cannot take these chances when you are dealing with a protein, isn't it? Because your proteins scenario would be a bit different. So in that case, what are your options? So these are the three different options in order to stabilize the peptide-based therapeutics. One, to enhance or modify the delivery mechanism. The example, as I have already given you, Placentex, if you go to a shop, you will get it 300, 400 rupees a tube, which is a wonder drug for bed sore or geriatric patients who are having these pressure ulcers on skin, and this works like a magic and heals the skin in a significant way. And how they have enhanced their stability? By putting it into an hydrogel. Excellent innovation. So then there is one more this thing, that is immobilization. So immobilization is a very efficient method in order to preserve enzymes which are very prone to degradation. And then there is one more method, that is peptide assembly, or making it into a scaffold. We shall discuss all this. So immobilization is also a very important tool which will ensure that your peptide is being preserved. I will give you a specific example of the pharmaceutical company, that is Abbott. Abbott is a very good company because it does a lot of innovation in peptide-based drugs. So what it did is it understood that to stabilize lipase, which is recombinant DNA lipase, which is very difficult to procure and prepare. So you cannot make it into a solution because it will instantly denature. Lipase I am talking about. In combination of pepsin, it is more prone to damage because pepsin itself is a proteolytic enzyme. So lipase itself is a protein. So pepsin will come and degrade lipase in a significant way. तो क्या होगा, आपका जो ड्रग है वो ड्रग का ये कम हो जाएगा, potency कम हो जाएगा. So what you have to do is you have to make it is a immobilized substrate. So how do you immobilize it? You immobilize it on a matrix of silica. So what they did is they prepared silica gel matrix or some inert matrix on which they have immobilized this lipase and then made it available for the patients for consumption. And you will be amazed to know that this pharmaceutical company produces a lot of lipase, and most of the lipase is delivered through oral route only. Understood? There is a very good medicine which is called Creon. Creon is a blockbuster drug and generates huge revenue for Abbott. And it is also immobilized on a solid substrate. And thereby they are enhancing the stability. So here also several other methods to enhance the stability. Now this is a liposome mediated delivery mechanism through which the protein based drug is getting stabilized. Okay. So let me give you some more example of these drugs. So what happens is a very good market is there for vitamin D. Okay. Vitamin D is a very important drug, but there is a problem with vitamin D. Vitamin D is unstable, and therefore you need to take at least 60,000 international units of vitamin D in a single dose. Because आपका जब अगर एक tablet होगा जिसमें 60,000 units of vitamin D is there, it will also get reduced to significantly, and ultimately your bioavailability will be there only for 3,000 international units. Okay, so it is so unstable. So in order to stabilize vitamin D, the same company did an excellent innovation. So what they did is they isolated cholecalciferol from salmon. Salmon is a fish which is usually found in tropical temperate region. Temperate region means colder countries, Europe, America, and those kind of region, northern hemisphere. So what happens is this fish is similar to Hilsa fish that is there in Bay of Bengal. Okay, similar pattern of this migratory. This is a migratory fish. So it produces a lot of vitamin D. Understood. But this vitamin D remains very unstable. So what the company did, it made a liposome in which they inserted this vitamin D granules. Okay, or the salmon vitamin D isolated from salmon and then made into a nasal spray. If you go to a shop, you will definitely get this vitamin D nasal spray, which is given in a spray Now this spray contains these liposomes. Okay. Now these liposomes enter into your nasal cavity and enters into your lungs and then get absorbed very nicely because you are not putting it through oral route. There is no degeneration of vitamin D and excellent availability is there. Accordingly, the price is also very high. If you go to a shop, you ask for nasal spray of vitamin D, you will get it. So how do they utilize this vitamin D? By making it into a liposome. Now this is a laboratory method by which very simple, not very complex method, how we make liposomes in lab. So there is no scope. We discuss all this step by step. Now these are some methods through which you can immobilize enzymes. For example, matrix assisted and then entrapping into a hydrogel. These are the common methods through which you can what do you call is enhance the stability of the peptide. But one thing is sure that until and unless you judge the functional integrity of the protein by using X-ray crystallography, then protein sequencing by MALDI-MS, and then by Western blot, and then ELISA and so on, you cannot be sure that these peptide drugs are intact, isn't it? So there are some more laboratory-based mechanism in order to preserve the active site of enzymes. As you can see here, some blocking material is there, which is blocking the active site of the protein and thereby increasing its potency. Then there is one more big this thing of shall I go to the earlier one where you can also have some bioactive peptides. Okay, so here I must talk about this the emergence of drug resistance in a significant way. So there has been several cases where resistance towards a drug is there, isn't it? And so most of us are very much aware of it. So madam, can you tell me whether the slide is getting changed regularly?
Yes, sir.
Okay. So drug resistance, when we're talking about, we are not only talking about antibiotic resistance, okay, which has already been a big problem. We are also talking about resistance against chemotherapy, resistance against vaccine, resistance against like insulin. That means the therapeutic proteins. So there is a significant risk of developing resistance towards any kind of therapeutic regime, whether it is a salt, whether it is a peptide, whether it is something else. Now, why this drug resistance is developing everywhere? Okay, so the prolonged use of any medicine will lead to resistance. Okay, so what happens is there is a prey-predator kind of relationship. For example, one deer is running to save its life, and behind the deer there is a tiger. So if nature only modifies the deer, what will happen is the tiger will die by itself and it will get extinct, isn't it? Because deer will always be successful to get rid of the tiger, isn't it? So nature doesn't want it. Nature wants everybody to stay, isn't it? So nature wants variety. So in order to preserve variety, what it does is it changes both the prey as well as the predator. So the predator, that is the deer, got rid of its complex network of horns. उसका जो सींग होता है लंबा वाला, so it has got rid of this horns so that it do not get entrapped in the jungle. At the same time, the tiger also has modified so that it can run much more faster than the previous tigers. So what has happened? There is a increment of or gain of function mutations in both, isn't it? So what happens is in the same is taking place in bacteria as well as some proteins also. For example, previously there was a time when methotrexate was only the chemotherapeutic drug, and it was wonder drug. I must mention about Yela Pragada Subbarao, who developed Professor Subbarao, who was working for at that point of time in I think in Bayer Pharmaceuticals in USA. So he developed methotrexate, and that was a wonder drug. Very sadly, Professor Subbarao never got a what do you call is this thing? What do you call is a Nobel Prize, which he really deserved. So, so he developed methotrexate, which is a folic acid analog, and it was doing wonders against all kinds of cancer, isn't it? So today, Dana-Farber Cancer Research Institute, which is there in most probably Maryland, USA, has a very big portrait of Professor Subbarao, In Indian universities also, it is not as big as they are. So everybody knew that the contribution is huge. So once upon a time, this particular drug was very good to tackle all kinds of cancer, but today it is not. Today you have to design a what do you call designer drug or kind of a monoclonal antibody to treat various kinds of cancer because the cells have been resistant to methotrexate therapy, isn't it? So there are possible cases that and the antibiotic resistance is very common phenomenon. Everybody knows about it. So what happens is, in order to tackle these things, what we need to explore is some novel peptides. So similar kind of novel peptides are there, which are low molecular weight peptides, and our lab has isolated this one of a very good novel peptide, and we have analyzed the structural analysis also. Now these novel peptides I shall show you. Yeah, now this is the novel peptide that we identified from our lab and then subsequently analyzed it. And these are only 9 amino acid residue. Are you getting my point? Very small molecule. So molecular weight is also very low. So there is a big problem to maintain the integrity of low molecular weight peptides. So if you are having a large molecular weight peptide, so there is a advantage of steric hindrance. So what happens in steric hindrance is the catalytic domain which is inside will be protected from the outer forces. For example, like ionic forces, hydrophobic forces, then van der Waals forces, so many things which are there in the nature. So it will be preserved due to the steric hindrance of other structural domain that are there. I'm talking about large molecular weight protein. But in small molecular weight protein, there is no steric hindrance. The active site is exposed. And therefore, there are very less opportunity to preserve the activity. So in our case also, it was the same. We found out an excellent opportunity in a bioactive peptide that we isolated. And we reported eventually in a proper journal. But the problem was that it was having very limited potency. Okay, so that was the big problem. So for last couple of years, we had several brainstorming session how to enhance their stability, and we found out that if we make them into scaffolds, okay, if we make them into scaffolds, then their potency increases. That means their stability increases. मतलब ये खराब नहीं होता है, उसका जो shelf life है, it becomes enhanced. So what happens is, so there is also one more problem that we cannot able to generate these scaffolds in a very significant way. So in the beginning itself, so we dependent on a lot of what we call as simulation technologies by using sophisticated software to identify that how much scaffolding is needed, or scaffolding means assembly of this peptide is needed. So eventually we identified an algorithm, and we have taken heavy discussion with this Cavendish lab of this Cambridge University. They are the forefathers of this peptide assembly protocols, and they have established several protocols and reported also for the scientific fraternity how to make peptide based scaffolds and assemblies of proteins. So from their inspiration, we tried to develop this peptide based scaffold, and we saw that in our initial report that it has been increased its stability. Matlab kya? It means that you are having a low molecular weight protein. It is bioactive. It is having some significant activity, but its stability is very low. So how you will enhance the stability? You cannot able to incorporate into a hydrogel. You cannot block its active site because it is already very small. So what you can do is you can artificially increase its molecular weight so that it becomes much more tough, resistant to the environmental degradation. So we are very much this thing that we took a specific permission also to use this specific figure of their literature. So this is also, I must also say that this is the lab which have proposed about a nanoscale based vaccine against coronavirus long back in 2012, approximately 10 years back, where there was no COVID. COVID-19 was established in 2019, but they were working on coronavirus, some other varieties at that point of time, and they thought, they only anticipated that one day there will be a massacre that will be brought about by this coronavirus, and we desperately need some specific type of vaccines, not the conventional one. The problem with the conventional vaccine, as you already know, that it is not customizable. So you take a vaccine, that means most of you and most of us have already taken the two different vaccines, that is the 2 jabs of the vaccine. Instead of that, you are not secure, because every now and then new strains are coming, and these new strains just simply ignore the activated beta cells and T lymphocytes which has been activated due to your vaccine. So your vaccine has no impact on these particular strains, although these are also coronavirus only. So this is also the high time that we think about customized delivery of drugs and customized therapeutic regime. Anyway, so these are some good examples, and this is how the stability of the peptide can be enhanced by reducing the delta G, which is nothing but the quantification of how much free energy a particular protein is having. So these are some basic concepts that are useful for teachers to describe how exactly delta G is related to degree of disorder or entropy. So moving on, there are several aspects of protein stability. Now these are the a peptide that we isolated. This is the singular peptide, which is within the nanoscale. And this is the dipeptide, where 2 different peptide has been assembled together in order to enhance the energy or enhance the stability. And this is the tripeptide, that means 3 peptide in a specific platform by increasing the functional molecular weight, so that they are more protected from the environmental degradation. So this is still in simulation stage, and we have conclusively say assembly can also enhance what you call as stability of the peptide. So now these are the energy scores which has been calculated by GROMAX, a package that is useful for identification of total energy present in a protein. Excuse me, madam, can you tell me whether the slides are getting changed in a specific way?
Yes, sir.
Okay, so these are some more slides where the energy content is being shown, which may not be of specific interest for many, but definitely of specific interest for peptide engineers. So these are some simulations where each and every amino acid has been identified and then made into an energy score. Here also we have seen that the overall mobility of the peptide is significantly reduced, and the stability has been increased when we made into a scaffold. So we did some this thing also, and eventually we will do some more analysis to show that how peptide engineering can enhance the stability of a peptide. So in the meantime, madam, madam, may I request you to please play the first video in a mute condition, so that we can give some more brief that how exactly proteins are being built in the industry, or the therapeutic proteins are being built. So okay, madam. The first video in mute condition.
Sir. Okay, sir.
So this is the this thing, that how exactly the insulin is being produced. Those who are aware of it will still can use this nice video for teaching their students. Madam, please play.
Yes, sir.
So this is a peptide and a wonder drug that has been generated by research and development of Novo Nordisk, a Scandinavian company. I had an opportunity through Government of India funding to interact in this region in Copenhagen, Denmark. The headquarter is there. So these are the beta cells from where insulin is produced, okay, in a normal man. But due to some autoimmune conditions, some people are there who have destroyed their beta cells, okay. So beta cell kharab ho gaya, so insulin is not getting produced. Now in these cases, what will happen? So they will get rid of this thing, insulin. So in that case, what you can do, you can use recombinant DNA technology for production of insulin. Okay. So how exactly it is there? So this is the whole genome of human being. Okay. You can consider that this is the whole genome. Okay. So we are having specific technology for whole genome sequencing, shotgun sequencing, and high throughput sequencing, like next generation sequencing technologies that is developed by Roche and Illumina. So this is the whole genome. So from that whole genome, the specific site which is responsible for production of insulin, we can cut it down. We can identify by there are specific methods of PCR based methods who are genetic, which are DNA fingerprinting method, through which we can identify कौन सा वाला gene कौन सा वाला protein को बनाता है. So this is the gene or the DNA which makes the 400 amino acids of insulin. So what we do is we will pack this gene, that is the insulin producing gene, into an expression vector. ये जो पूरा blue color का था half वाला, that was an expression vector. Now this is a complete recombinant gene which will put it into an E. coli. So it could be E. coli, it could be yeast, depending on your kind of protein that you are using. Now what the E. coli will do, E. coli do not know all these things, that it has received a foreign gene. So it will do not know, it will just keep on developing its own, what do you call, progeny, and thereby produce a lot of insulin. Now that insulin will be purified. Now this case you should definitely use HPLC, and then only it will get purified. So there are specific reason, because क्या होता है, it produce in a small amount only. So in order to specifically isolate a protein from small amount, you need to use this kind of techniques. Now this we are not using for research and quality control. We are using it as a production facility. Anyway, so this is how the recombinant DNA technology is used for producing of peptide based proteins. Okay, that is a very old method. Nowadays there has been several changes in that. So that was the thing. And once you have made the proteins, so you will be you want to know whether your protein is intact. मतलब क्या, whether your thermodynamic stability is there or not. So how will you analyze your thermodynamic stability? उसके लिए भी specific methods है in order to identify whether your thermodynamic stability is there, the protein is intact or not. Now there are some limitations of this, as I have told you, that it is not every day you see a lab where MALDI MS is there or where X-ray crystallography is there, isn't it? So it is not very frequent. So what you can do, smaller labs like us, what we can do, we can depend on simulation methods. Okay. Now what are simulation methods? Simulation methods are nothing but a machine learning algorithm which will identify what will happen if you are putting a protein into a stress, whether the protein can withstand the stress. For example, you have prepared the insulin. Now you do not know whether you can, you have to preserve insulin at -4 degree or -20 degree. You do not know. So it depends on what? It depends on which kind of stability the inherent protein is having. If the protein is so stable, like oral polio vaccine, everybody knows oral polio vaccine is such that you can preserve it in a normal freezer. No need of hi-fi, this thing for prolonged preservation also. But this is not the case for the Moderna vaccine or the DNA vaccine that is about to come in the market, which needs a specific kind of refrigeration only. Why? Because the inherent stability is less. So how do we detect whether हमने जो protein बनाया है that will be stable or unstable? और अगर stable होता है तो कितना stable होता है? That also we need to analyze. But our lab is having so much of fund crunch, we cannot afford this kind of techniques. So what we will do? We will simulate the whole procedure. So madam, I will also request you to play the second and the third video, I guess, which will demonstrate in a mute condition to have a brief idea that how protein molecules behave in a force field. Now force fields are nothing but a calculation of several forces. Let me give you one example. Agar aap, if you break an egg and put it into a water, what will happen? So water will try to denature the protein, okay? Because previously the egg was present, the egg white, which we call albumin, Ovalbumin was inside an egg. ठीक है, और egg का चारों ओर क्या था, एक shell था which protected it from various kinds of effects, isn't it? But now when you have put it into the water molecule will try to solubilize the albumin, isn't it? So what it is doing, it is putting some kind of pressure on the molecule. So we will try to simulate the pressure on the molecule. Now this is our protein that we isolated. Now we are putting it into a pressure and simulating to see how exactly it looks. Okay. So madam, I will request you to play the third and the fourth video all together. Means what? In two different windows. तो ऐसा कीजिए कि you use two different players, madam, if it is possible, and both the videos will be played in the single this thing. मतलब
Okay, sir.
in
I'll try
half
to.
the. If it is there, madam, so they can able to see the change. Otherwise, they will forget that.
Sir, I'll try. Just
Many
give me a moment.
participants. Yes, madam. Sure, madam. Sure. So what happens is because those who already know about molecular dynamic simulations for proteins, they will be knowing it, but those who are new may not able to correlate that what exactly is happening there. So it is nothing. We took the protein and then put it into a simulation box. A simulation box is nothing that you are putting the water and putting some temperature and putting some salt, everything together. Means what? You are putting van der Waals interactions, you are putting hydrophilic and hydrophobic interactions, you are also putting ionic force, isn't it? So we are doing all kinds of things to destroy the protein. Now we want to know how much the protein can withstand. Understood? So it gives us an indirect proportion of the stability of the protein. So here also, during the time madam plays it, here also the Indian scientist Professor G.N. Ramachandran should come in context, who also never got a Nobel Prize but deserved it very badly. So he was the one who proposed Ramachandran plot, which is used today even for protein engineers to devise new proteins and vaccines, and therefore today it is possible to design a vaccine within a 1 year. It is possible because we are having very good simulation tools today. Which is very costly also, but these are available. So you can design a peptide-based drug very easily. So yes, so this video, which is still running, is showing that the protein is very, very fragile. You cannot able to see it properly. So what you are seeing that the protein is getting destroyed rapidly. Here you see. So it was a 15 picosecond screenshot. We put one after another. And we made this video. So what does it showing? It is showing that the protein is degrading very rapidly. You cannot able to find out any intact structure in the protein. Okay. But if we play the second video in the same simulation box, the same protein, but with enhanced molecular weight. Here you see. You can at least see the alpha helix, isn't it? आप लोग क्या मतलब alpha helix, one telephone like wire you can see. So it is a part of the protein. So previously the protein was getting degraded rapidly, but now it is also getting damaged rapidly, but in a the stability is bit increased, isn't it? So what does it mean? It means that by using simulation technology, we can able to understand that how we can enhance the stability of the protein. Isn't it? So that was the two comparative videos. One less stable, another more stable. Not completely stable, but comparatively more stable. Isn't it? So it takes a lot of simulation ability of your computer to capture these images. Anyway, thank you, madam, for sharing it. So there are no video files, I guess, no, madam? So I'll start sharing my own again. And once again, I'll come back to this part. So what we are trying to do is we have whatever the peptide we have isolated, we are interested now to enhance its stability. So why we are trying to enhance the stability? Because we know this is a good peptide and we need also have to enhance shelf life. If the shelf life is very low, no company is interested in this, isn't it? बिकॉज इसका इतना ही शेल्फ लाइफ कम है तो क्या कीजिएगा इसको फेंक देना चाहिए. So they are not interested. So in order to make them interested, we have to design some strategy to enhance the stability of this peptide based drug. So these are some more strategy through which you can change the structure of the protein. As you can see, initially previous क्या होता है, जो candy जो है तो देखिए किस तरह से distorted है. So blue red. The anticipated candy structure is how a complete blue candy, complete red candy, isn't it? So this is our anticipatory goal. So what exactly we do have? What are the methods that we can use in order to generate a protein with a desired trait? This is our objective. So for doing so, what we can do is, now these are some very good examples where protein engineering has given tremendous result. Okay, so how previously the protein usually got degraded, but after a protein engineering methodology, what has happened is the protein has become more stable. Not only more stable, it can handle much more residues. As you can see here in the first case, पहला जो example है देखिए, there is a 52-fold improvement in hydroxylation. Understood? So what happens is there is a huge possibility of changing the behavior of peptide based drugs. So I'll give you some specific examples which are very celebrated examples of protein engineering. Okay, these are the hallmarks of peptide based therapeutics. Now here I am sharing with you an example where in the wild type pyruvate decarboxylase is an enzyme. In the wild type, it can only accommodate a proton. If you can see, the proton is there, H plus. H plus is getting into the product and it is making an acetaldehyde molecule. But after we made a protein engineering, it can now accommodate a complete benzaldehyde molecule. Can you able to see? In the second case, we are previously it is wild type PDC, or after the protein engineering, its name is E473Q PDC. मतलब क्या? We did a protein engineering, genetic reshuffling in the structure of the protein, and then we are eventually making an enzyme which can accommodate a far big substrate. Understood? Previously only a proton was accommodating, now a benzaldehyde molecule. So we are altering the reaction specificity altogether of a protein by making protein engineering methods. So this is possible. Now this is also possible. Previously we had an enzyme which can only accommodate phosphorylated product. जिसमें एक phosphate group है, देखिए glucose 6 phosphate, fructose 6 phosphate. Okay, but later on after protein engineering, we have made into a protein, a desired protein which do not need a phosphorylated product, which can directly use fructose as a substrate and then eventually can produce other products. Okay, these are some very good examples, but there is very less scope that we discuss each and everything in much detail. So here again, this is also a very good example of wild type protein was only accommodating 3 malonyl CoA. ठीक है, लेकिन after the protein engineering we can accommodate 2 malonyl CoA. So how exactly we did it? Here you see, we changed the active site. देखिए active site का geometry जो है उसको हमने change कर दिया है. How exactly we did it? We changed the structure of the protein so that previously 3 malonyl CoA was there in the active site. As you can see, the long chain. Later on, it has become 2 malonyl CoA, and the structure of the active site has also been changed. Can you able to see new pocket? Isn't it? A new pocket has been developed, and therefore we can accommodate a new different substrate altogether. So these are the strategy that we can do. There were several more. Now, how exactly we do it? So we can use an analytical, not exactly analytical, but experimental tool that is known as error-prone PCR. PCR is a method where we are using DNA fragments as our target. Okay, and in error-prone PCR, we can accommodate some genetic level mutation, and therefore we can change the behavior as well as structure of the protein. So protein engineering is a huge this thing, and the idea of this particular session was to give some brief idea. However, these are some more protocols through which in wet lab we generally introduce DNA level mutations, and therefore it also changes the structure of the protein. Now, if your protein is a drug or a medicine, this is very, very important. Okay. So these are also again some PCR based methods. The concept part is so detailed that the analytical part is getting compromised. So these are some again some very good examples where we have changed the structure of the protein by using this kind of tools and subsequently achieved very good result in starch processing. Starch in many different aspects. Starch processing is very important for pharmaceutical point of view. Now, how small labs can handle this kind of techniques? For example, in order to introduce a single mutation in a protein, approximately I have to write to DBT, DST or AICTE for approximately 25 lakhs of funding. Then I'll recruit a person who is good in this kind of techniques, and then I shall start my journey. So 25 lakhs for a single mutation. Okay, so or single change in the structure of the protein, and then you need to do X-ray crystallography and so many other things. So it is very what do you call this costly engagement. So what we can do is we can use machine learning and big data in a significant way in order to reduce the cost. So I will not able to discuss it in a proper in an extended way because we wanted to do a little hands-on event. So this is again a machine learning based tool which is called probabilistic classifier tool based on the naive Bayes algorithm, which help us to identify what will be the behavior of a protein. Now, in order to find out the behavior of a protein, we need to do a pattern recognition application of the whole computational system that we are now interested in, and we are constantly doing some active research for this. Now, this is also useful for finding out the specific epitope that will be give rise to a very good vaccine. So ऐसा ना हो कि आपने वैक्सीन लिया फिर से आप कोविड के शिकार हो गए. So in order to protect you and so that your vaccine really works, you can significantly use machine learning tools and techniques. And this is again a particular hands-on that how computational strategy can help us to identify or to incorporate some change in the structure of a protein. So we'll do a little hands-on here. May I request our coordinator, madam, to share her screen and click on the icon that has been downloaded through the link that I have given. Rasmol is a small package which is written in C++ and Python. So this tool help us to identify or visualize that how exactly behavior of proteins will change. So madam, if it is possible.
Yes, sir.
So consider that this is a madam, what I want you is to open two Rasmol windows. So how you will do it is you will open one Rasmol, click, and then once again click on the icon. So the two different windows will open, madam. You minimize this.
Okay.
Yes, you minimize this, madam. Yes,
Yes, sir.
yes, and then once again, again click on the icon. So two windows will come. Only
Sir,
the GUI you use. Madam, how you have opened this file? Have you directly clicked the file, or you have opened the this thing, the icons? Have you clicked on the icons? Can you able to share the desktop so that you can close it, madam?
Okay,
I want
okay,
it in
sir.
a particular way.
Okay.
Yes, yes. So it will become more easily understandable by the participants.
Okay,
हाँ
sir.
मैडम, आपका स्क्रीन अगर शेयर करेंगी, हाँ, तो you have to click on the icon first.
So I have to click on the Resmol icon, the software.
Yes, madam. Yes, madam.
Okay.
हाँ, हाँ. तो इससे एक विंडो ओपन होगा मैडम.
Okay. So let me just...
हाँ, अभी उसको मिनिमाइज कर दीजिए. तो रासमोल का आइकॉन को और एक बार क्लिक कीजिए. So what will happen? Two windows will come, madam, simultaneously.
Sir, I'm not getting actually. Just give me a moment, sir. Reswin is your software.
No problem.
This is the window. Uh,
I am not able to see your screen, madam. The computer का जो screen है, if it is visible, because the icon should be in a proper way. It is you are only sharing a particular window, madam.
Yes,
Please
sir.
share the whole screen.
Whole screen. Okay. sir.
Madam, please share the. हाँ, सही है. Then it will be easy. So what we are trying to do here in this small hands-on, if participants are interested, they can also do. So what happens is this is a peptide-based therapeutics. Okay. So we do not know which is more stable. So what is our idea? For example, you are having insulin protein. Okay. So in your company, you are making one kind of insulin with a what do you call is expiry date of 1 year. But the other company is making one more insulin, which is having expiry date of 2 years. So how these are different? Both are therapeutic drug only. How these are different and how you can analyze the stability of these two peptides, because this must be different. There must be something different in these two, isn't it? So how they are different and why they are different, that you have to find out. So how exactly we can use computational tools? Rasmol is only 25 megabytes MB. 25 MB is like a photograph. So many a time, madam's photograph is more than 25 MB, I guess. So the package is so good, only in 25 MB, you can do excellent simulation. So हाँ मैडम, हाँ इसको मिनिमाइज कर दीजिए मैडम. हाँ इसको वो हाँ हाँ इसको मिनिमाइज कर दीजिए मैडम. हाँ प्लीज मिनिमाइज इट. Madam, in your screen, the Rasmol icon is there.
Sir,
The Rasmol icon.
So there is one.
Have you
software-
downloaded the package, madam?
Yes, sir. I have downloaded the package, and it is like Raswin, and it is showing just blank screen, sir. Black screen.
I want
it is
that
showing.
blank screen, madam. Yes.
Okay. Okay, sir.
I want that black screen. Yes, yes, yes. Yes, great, great. Okay, madam. Similarly, one more window you will open. This window, इसको थोड़ा drag कर दीजिए side में, और वो click करेंगे और एक बार तो दूसरा वाला window भी open होगा. So, madam, what will happen is if you click twice, still, madam, your whole screen is not visible. Only a window is visible. Madam, please unshare and then again share and select whole screen.
Okay.
Only a single window. It is not possible then. Yes, madam.
I have to share the screen, and it is just showing the option of single sharing. So it is not showing all three or two windows at a time.
Oh, acha. Okay, anyway, so please go to the black window, madam. Please go to the black window.
Yes, sir.
Okay, fine. So here, madam, go to files. Yes, go to files.
Yes, sir.
Open the first data file. That is L1 model. First data file.
Yes, sir.
Now, where is the L2, madam? There should be the L2 model also. L2 you have downloaded now, madam?
Yes, sir. Both are here.
Both are here. चलिए किसी एक को मैडम क्लिक कीजिए, उसको लोड कीजिए. इसको लोड कीजिए. हो गया. तो मैडम अभी डिस्प्ले में जाइए. प्लीज गो टू डिस्प्ले पेन.
Yes, sir.
Yes. And then do the this thing molecular surface. Please go and do the molecular surface.
Yes, sir.
Great. Yes. It will do a little calculation. It will take 1-2 seconds. आ गया. So madam, now go to colors window. Colors.
Yes, sir.
देखिए colors है.
Yes.
Yes, madam. Please click and go to temperature. Temperature. Okay. Now please see. So what happens is this tool Rasmol now this is the molecular surface of a particular peptide, for example insulin. ठीक है? Now we want to know what is the overall B factor or displacement factor of each and every amino acid that is there in insulin. Okay, so what we did, we went to colors and then put it onto temperature. Now temperature is an indirect calculation of stability. Okay, delta G is equivalent E. So what exactly it says? The second law of thermodynamics, delta G is equal to delta E minus T delta S. ठीक है? तो हमने T delta S को avoid कर दिया. Let T delta minus T delta S is equal to 0. ठीक है? So what will happen? Delta G is equal to delta E, isn't it? So here it is something like this. हमने what we did is we have avoided T delta S, temperature, delta, entropy. We have avoided. So after the avoidance, what will happen? It is only showing the overall stability of the protein. Okay. Now this is one protein. Okay. Now as you can see here, the stability of the protein is different because the colors are also different. Red color means less stability. Blue color means more stability. And green, yellow, and all such things indicate different degrees of stability. ठीक है? What we are trying to say is the different areas of insulin is having different degrees of stability. ठीक है? So what happens is it's what do you call as expiry date is 1 year. So what is our goal? Our goal is to preserve the structure of insulin, but to increase the stability. That means to cover the whole molecule in blue color. अगर ये blue color हो जाता है, blue means more stable. Okay, blue means more stable, red means less stable. So what we can do is we can do a protein engineering, and then we can also try to make the whole protein blue in color. So you cannot make the whole protein blue in color just like that. You need to produce some mutations by using PCR based techniques. Okay, the ultimate result is the second protein. Madam, now I request you to close it. Yes, completely close it. Yes, then again click on the small icon and then load the second molecule that you used. Yes. The second molecule if you load. So please remember those who are already present that initially what we did at the first time, we identified the insulin molecule and this is the native insulin, that is the wild type, normal जो होता है. उसको अगर आप बॉटल में बंद करके रखेंगे वो 1 साल नहीं 1 month भी नहीं रहेगा because its stability is very less. But Novo Nordisk has generated what do you call as your an insulin which is very stable. So how exactly they did it? वो लोग ने क्या किया है कि उसका 1 साल तक आप उसको रख सकते हो at least in fridge, but you can at least stable it. How? So madam, please again go to files. So this is the second data file. Go to files, open the second molecule. If you can remember the second molecule.
Yes, sir.
Open it. Okay, now again display some molecular surface. Please go to molecular surface. Yes. Okay, then go to colors. It will do a little calculation. It will build the surface now. No problem, it will come. Madam, all other video files and everything, no, try to close them.
Okay, sir.
If it is there in the background, sometimes इसको computation करने में दिक्कत होता है.
Okay, sir.
So in the first file, we saw that the whole structure of insulin is such that थोड़ा part ही उसका blue है. मतलब small part is only more stable and the other part of the protein is You cannot able to predict it. Some area blue, some area green, or something like that. So, madam, if it is not coming, you close it again.
So now it.
Okay, okay, it came. Fine,
Yes.
fine, fine. Now, as you can see here, the structure remained same. Okay. Now we'll go to colors, madam.
Temperature we have to.
Now temperature. Yes, great, great. Yes, yes, yes. Right, absolutely. Right. Now you see, this is the second molecule. Can you able to see what exactly we did? Please see, we have changed the aspartic acid 74 into phenylalanine. ऊपर ये फाइल का नाम थोड़ा देखिए मैडम सर सब जो भी है पार्टिसिपेंट्स, ये मॉडल जो है, ये जो प्रोटीन है, ये एक पार्ट है इंसुलिन का. So the part is known as L1. So L1 model domain, in that the name of the protein is ASP74PHE. What does it mean? It means that the 74th amino acid was previously aspartic acid, and now we have changed it into phenylalanine. Okay? Now a single amino acid has been changed. Okay? Now see the structure of the protein. See, it is completely blue. Means what? It is highly stable. But the structure of the protein, if you can superimpose one on the other, you would have seen that the structure is same. So what does it mean? It means that it will do the function of insulin only, but its overall stability will be much more. So this is our this thing of our lab in order to visualize and analyze peptide based drugs and to visualize their stability. So now the drawback of computational this thing is, and as you can see, a terminal residue is fully red. ठीक है, मतलब इसका बहुत ज्यादा मतलब stability is less. So what we can do is we can cleave this particular site and rest of the protein will be intact and it will be highly stable. So this is how protein drug designs and drug design in a with proteomics will work hand in hand. Okay. So thank you, madam, for your nice coordination. And now I shall again share my screen. Okay. So now there is a problem. The problem is that a single tool cannot able to do everything. Different tool is needed. एक tool चाहिए mutation के लिए, एक tool चाहिए उसका analysis के लिए. So many different things are there, isn't it? So this is a very big problem. So we were working on it, and last year we had able to write a paper on what is happening due to the mutations on COVID-19, and we are fortunate that WHO has made our paper as a hallmark, and in their website also they have put our paper in a significant way, and we are happy to share this information with you. So just so in WHO website also our this thing is there, where we have tried to explore the mutational events that could be lead that could generate potential mutants. This was reported when there was no mutant during start of 2020, in the beginning of 2020. Okay, so and we significantly used machine learning tools and technique. Now this is the method through which genomic data is explored. This is called whole genome sequencing, and we were exploring the hands-on. These are the database where genomic data is present. I hope that our slides are getting changed. So during 2014 also, we received a small grant from an international body which was working on a genetic disease called Barth syndrome, which is an inborn error of metabolism, where we were first interacted with computational tools for predicting of outcome or a disease outcome, where we significantly used computational tools. But during that work also, we came across of this difficulty that there is no single tool to analyze all possible proteomic changes that is there. So for last 4 and 5 years, we were working on a project, and subsequently we have developed a patent through which we can do all the thing in a single hand. And we this is the setup of the equipment that we have designed. And we are in talk with some small scale industries who have shown interest to monetize our product, and we anticipate that we will collaborate with that particular firm, and in coming future we will also able to monetize our product that we came from the lab. So by saying so, I'd like to conclude my session. The overall objective of the session was to give a brief idea of several tools and techniques that are useful for protein engineering and peptide based drug design and analysis. If there are some questions from participants, I will definitely try to answer them and we'll be happy. So by saying so, I'd like to conclude.
It's a kind request to participants. Kindly share your question on chat window if you have any queries.
So that was the objective of the whole session. If there are some questions, I will be definitely like to answer.
Participants, if have any question, you can post it in chat window. Sir, I think you have explained in such a good way that no one is asking question to you.
And they are saying it was very
No
nice.
problem.
They are saying, sir, nice and informative session. Participants are writing nice and informative session. One participant, very good and informative session.
Okay, thank you for giving me the opportunity to discuss the work that we anticipate to do.
Thank you, sir. Thank you so much, sir, for taking the time to speak to our participants on this relevant topic, that is peptide-based drug engineering and simulation.
One participant is asking, is this useful for herbal extract?
Yes, definitely. I'd like to answer it in this way. Now, when we essentially most of the time talk about herbal extracts, many a times we are looking into the amount of antioxidants that are there, and some kind of volatile components which may be possible, glycosides, and then various other kinds of these things, and we want to explore their activity. So until and unless it's a protein, you just cannot able to use protein engineering in them. But there is one more aspect to it. Please understand. For example, you are interested in a secondary metabolite of a plant, okay? And you have studied from your literature and all your proteomic studies that a particular secondary metabolite, for example, a volatile compound which is needed for making some kind of antioxidant, okay? So that particular antioxidant which is present in a plant is produced by means of several pathways, and in that pathway there is a particular enzyme. So what you know that a particular enzyme is needed. For example, scopolamine synthase. Scopolamine synthase is needed to produce a secondary metabolite which is scopolamine. So scopolamine is needed for many plants for their plant regeneration and several other things. So you cannot engineer scopolamine as such, but you can definitely engineer scopolamine synthase. So what you can do is you can enhance the activity of scopolamine synthase so that 10 times more scopolamine is produced in your plant. So how exactly you will do it? You will do the genetic engineering and then put it into the callus. Callus means in the tissue culture flask, so that the callus receives the what do you call is the recombinant gene, and then it integrates it into the genomic DNA. सो क्या होगा, आपका जो स्कोपोलामाइन सिंथेस का नॉर्मल डीएनए था, नॉर्मल जीन था, after your tissue culture is complete and you are ready with your explant to put it into the field trial, at that point of time you will see that 10 times more scopolamine is getting produced. Now this is true for any plant metabolite that you are interested in. You may not be interested in scopolamine, you may be interested in some more other volatile and non-volatile components, for example terpenes and all other things that you know already. If you have very good background in pharmaco, plant related things and all such things, so you can definitely know the pathway. So if you know the pathway, you definitely know the enzyme. So what I was trying to say is we can definitely apply protein engineering in most of the cases for our beneficial aspects. For example, there are some plant based things. So let me give you the example of this thing, what you call is chloroquine. So once upon a time, chloroquine was devised for malaria. Then there has been a rapid repurposing of chloroquine. Most of you definitely know that chloroquine was then repurposed for rheumatic arthritis, because in rheumatic arthritis there is no other medicine that can heal the pain of the bone joints. अंडरस्टूड. आप किसी भी दुकान में जाइए, क्लोरोक्विन के बारे में बोलिए तो दुकान वाला आपसे पूछेगा आपका बोन में दर्द है शायद, you are definitely a patient of rheumatic arthritis, therefore you are asking for what, this chloroquine phosphate. He will be sure that you are not asking for malaria, because for malaria some more advanced treatment has come in the form of artesunate, artemether, arteether and all such things. You will be definitely knowing. But today you will be amazed to know that chloroquine, a plant-based drug, was repurposed for COVID-19 also. Why? Because it has shown some affinity towards ACE2 receptor. ठीक है, angiotensin converting enzymes receptor where COVID-19 virus attacks. So once we saw the US president was for this thing that he was asking for chloroquine by any cost from India, because India produces chloroquine in a significant way, isn't it? So so if you know the pathway of chloroquine phosphate, you can definitely do some kind of engineering, but it needs huge lot of trial and error and then you can finalize. So what I'm trying to say is theoretically it is not this thing that you cannot use it in plant extract and all such things. In a different way you can definitely able to do it. This is how I'd like to answer it. I hope you have get some idea on this.
Thanks a lot, sir. It was such an amazing session and a nice, very interesting session it was. I felt that your simulation part specifically was very interesting, and it helps us a lot to understand the whole topic in a much simpler way. So thanks a lot, sir. Thank you once again.
Thank you all. Thanks a lot. Thanks.
Thank you, Dr. Surjit, for accepting our invite. Thank you, sir.
Yes.
Thank you. Participants.
Thank you. Thanks a lot.
Okay. Participants, we will meet tomorrow at 9:30. And I have shared the link for the feedback and attendance for all the 3 sessions on the official WhatsApp group. Kindly fill that. Okay. Thank you, everyone. So let us leave, Rupali madam.
Yes, sir.